Hey everybody, thank you for joining us for another Doc Geek session from my home. Just a quick heads up, I forgot to tell you, Dr. Petersons, my dog is sleeping right next to me on the couch here and she might start snoring. So hopefully she doesn't go too bonkers or anything while we're talking today. I did have to work from home because we have some baby related deliveries coming to our house that just don't want to have to take home from the office. So hopefully the delivery does not come while we're talking and disrupt everything. But if it does, I might pop off screen and mute myself. Just keep going, okay? All right, so we are here today to talk about a really important topic. This is actually, of all of the things that we've talked about on Doc Geek sessions, I think this will transform your ability to help your child get better, faster, by working with the homeopath and giving the information that you need. And some of the moms have already talked about this in a couple of other videos, that this is one of the most difficult things, one of the most difficult transitions to make as a PANS or PANDAS mom or parent, sorry, dad's parent, because you're so used to having to be an investigator. And Dr. Peterson is going to talk to you a lot about that transition from investigator to observer. So let's just go ahead and dive right in. Oh, and by the way, guys, as always, if you have questions for us, ask us as we go. Dr. Petersons, I may interrupt you here and there if there's a really pertinent question that should be addressed in a timely manner. So yeah, go ahead, take it away.
Great. Well, I was really looking forward to talking to you all about this because I know it's one of the things that everybody asks about, what should I be looking for and what do you want to know and what's important and what's not. And I really thought this would be a good idea to shed some light on that and what we do look for. So step number one is you have to move from being the investigator to being the observer. And I know that most of you have spent your child's life kind of trying to figure out what happened, what went wrong, what was the cause, what was the thing, what's going to be the thing that fixes them, lots and lots of researching, and that's all wonderful. But for homeopathic treatment, we really need you to take a step back and be less of an investigator and less of well, I think this happened for this reason, and so I don't think that's important. And I think this happened because I gave him sugar, and then I think this happened because of, this other kid that made him upset. Being less about what caused it and more about what happened. So yes, I gave him sugar and then he had a tantrum. Okay, what did his tantrum look like? Well, he laid on the floor, he was kicking and screaming, he turned bright red, and he wanted me to give him a hug. He was crying for attention. And that's going to be a lot more detail for us than just he ate sugar and he was absolutely out of control and I didn't know what to do with him and I gave him ibuprofen and he's just been terrible. That doesn't give us a whole lot of information. It doesn't give us the details that we really need. So really taking a step back, just watching what you're seeing and then jotting down notes of exactly what you're looking at. We're a fly on the wall when you report back to us. And also with that, when you are kind of watching and recording the symptoms that you're seeing, looking for quantity of symptoms, how often are these things happening? And that's really for us so we can gauge how much better they're getting with treatment. So knowing that, they're having tics 5 times a minute versus 5 times an hour they're different. And so that's helpful to have some quantities. I don't think you have to get too nitty gritty or
no stopwatch or anything like that. That's not necessary. But I want to pause you there for a second because this is one really important thing to recognize is that, we've talked about this before, but we can't emphasize it enough. Homeopathy is not going to just make everything disappear overnight. It's not going to squash all the symptoms right away. Sometimes it can look like it's doing that, but then the symptoms will come back. And so it's an up and down. More often what we see is we see a reduction in frequency, intensity, and duration of symptoms, and they continue to get less frequent, less intense, and less shorter time frame that they occur until we just don't see them anymore. So we do need to have that thing to look at to get that progressive understanding of how things are going. Because if you come and you say, my kid still has tics, okay, well, are they significant? Are they still happening just as often? We could end up leaving a really effective remedy if we're just getting, well, there's still tics there, and I just want them gone. And we could lose a lot of really good healing properties from the remedy because we're not looking at the totality of what's going on. Sorry, keep going.
Exactly. And especially if you find yourself, a parent who who is a little unsure and doesn't know, like, what are we seeing and is it helping or is it not? When you put those quantities on there, it becomes a lot more black and white, and less like guessing, like, oh, I think he is a little bit better. It gives us more quantitative data to go off of. But qualitative is just as important. So step 2 is just watching, recording, and then, what are you seeing and how often are you seeing it? And then what is important to look for? That's step 3. So a kind of mnemonic that we used in school was COLO-MO, condition, location, and modality. What the heck does that mean? So condition is, what are we dealing with? So you might say, my child has diarrhea. Okay, so that's helpful. It kind of comes with its own location. But with that diarrhea, there's tons of other things that could go along with it, right? There can be stomach cramping. It can be painful. It can lead to an itchy anus. It can lead to blood. It can be, liquid, or it can be loose, or it can be hard and then loose. Like, there's all of these different specifics that go into the condition. It's not just diarrhea. There's more to it. And those little specifics are what actually allows us to find the remedy, because there's 2,000 remedies that actually produce diarrhea. And so we need to have more information about that. And then with that, one of the most important factors is the modality. So the thing that makes the condition a little bit worse or a little bit better. And a lot of times whenever I ask that, what makes it a little bit worse or a little bit better, I always hear, well, ibuprofen makes it better. Okay. Yep. We're not talking about supplements or medications, because typically those are suppressive and they just get rid of the symptoms but don't actually heal it. So when we ask those questions, we're more looking for things in the environment or things the child naturally does to alleviate the symptoms. So some kids, they get really itchy eczema and they want a hot shower to help with it. Some kids get really itchy at eczema and they take a hot shower and it makes it worse. So those would be very specific modalities. A hot shower makes it a little bit better or a little bit worse. Fresh air. My child gets headaches and I take them outside and their headache goes away. Fresh air is the modality. So again, very, very important thing, because it narrows our remedies that we're looking at quite a bit when we get more about the modality.
And they're so helpful. And one of the things that can be really challenging is that we are so used to looking for external things to take to make something go away that we have a hard time paying attention to, like, well, what's happening around us, and so, sorry, keep going.
Yeah. And that's, it's really, when we've been dealing with this for so long and we have our toolbox of things that we know works, and we just go straight for the magnesium when they're constipated, or we go straight for the ibuprofen when they're having a headache, whatever it is, like, we become very accustomed to that, and we don't take the time to kind of step back and observe, or even do a little bit of experimentation. Like, does your headache, do you want a cold cloth for your headache? Do you want a hot pack for your headache? Would a hug make you feel better? Do you think going outside would make you feel better? Should I open the window? You can try some of these things and see if it makes things a little bit better.
Trying is the important thing.
Yeah.
Right? Like, so here's the thing, like, imagining what you want is very different than when you actually get it. Right. And so saying, do you think that this would help you? And then not experimenting, that doesn't help us at all.
Right. That's a very good point. And actually doing it and seeing, like, does this hot water actually make your eczema better, or does it actually make it worse? Not that I want you to do that and make your eczema worse, but that kind of data is going to be the thing that cracks the case. And those are the things that really help us kind of see into what's going on inside the body and how it's responding to its environment. So really, no detail can be too much, and it can be anything. So don't limit your observations to just, hot or cold, packs or water or fresh air or inside, because anything that you notice that's making it a little bit better, a little bit worse, could matter to us. So if you see something, say something.
And don't get too hung up on it if we move past it, because sometimes the things that we see, we just don't have evidence for in the materia medica. So it may be a really useful symptom for you to be aware of for your child, but it's not a really useful symptom for us to find the remedy. So just keep that in mind, that if we move past it, we're not blowing you off. We just are aware that this is not a useful symptom for prescribing. And so that can get really frustrating for parents sometimes too, because they're doing a good job observing and they're finding this really weird thing that's happening with their kid. And they're like, this has got to be usable because it's so weird. And we're like, it is super weird. And maybe we'll be the ones to add it to the materia medica because it's not there right now. You know, we've got to see how it goes. So that's one of the things that can get frustrating. It's frustrating for us too. Trust me. Like, how many times have you, Dr. Petersons, I know, you know, I've been doing this a lot longer than you have. But I know how diligent in research you are, that like, how many times have you beat your head against the wall trying to find this really, really unique symptom, and you're just like, it's got to be here. And then you reach out to me and I'm like, yeah, it's just not there.
Nope. Yep, exactly. I'll be searching Command F through every materia medica I have, and it, you know, I can do it till I'm blue in the face, but if it's not part of the provings, the original in those texts, then it's not going to help us kind of crack the case. Although we still may track it, it's not going to be the thing that is the most useful for determining the next remedy.
So before Dr. Petersons and I got started, I was asking her, she was like, I'm going to talk about Colomo. And I was like, all right, so I've been out of school a lot longer than you, and like things evolve and how people describe things. So make sure you tell me what that means so that I think I know what you're talking about. And so we actually did learn different ways to really differentiate. So I thought I'd bring up the way I learned too, because I think it can also be helpful. Is this a good time for you, Dr. Peterson?
Yeah,
I'm not like disrupting your flow? Okay. So we learned the mnemonic miracles, which stands for modalities, which Dr. Peterson's already talked about, like what makes things better, what makes them worse. Intensity, which is important because something could be a common symptom in a condition, but it's so intense in your child or in yourself that it actually makes it more characteristic by how intense it is. R stands for radiation, so like where something starts and where it heads to, because, you know, if you have heat, that's like, you know, your kiddos, right? They have flushes of heat a lot of times. If their heat starts in their belly and it goes up, that's one remedy. And well, not one of many remedies. If it starts in the belly and goes down, that's different, a set of remedies that are going to be effective for it. Or if it starts there and spreads everywhere, again, another set of remedies. So that radiation is important. A is for alternating, and C is for concomitant. So sometimes we'll see that like these symptoms, this cluster of symptoms exists, and then these other ones come on and these go away. And then as soon as these other ones go away, these ones come back. That is useful information. Concomitant, every time I get a headache, I also get diarrhea, since we're talking about diarrhea, right? And that's the only time I have it, you know, or every time I have a headache, I have to pee a ton. Oh, and that pee makes my headache go away. Well, then you're going to get gelsemium, you know, because that's a really, really specific modality and concomitant that is specific for one remedy. That's how, like, I mean, you knew I was going to say gelsemium, right, Dr. Petersons?
Yeah.
Because you really said that. Yeah.
Exactly.
Okay, so the C is for concomitant, L is for location. So L is still there for location. E is for else, where, you know, it's just a reminder to all docs to ask anything else. Like, I don't know how many of you guys have worked with us, how many times you've heard us say anything else, anything else, anything else, because you just never know. And then S finally is for sensations. So it's the exact nature of what you're experiencing. So especially, like, I always give my example because I have migraines that are much better with homeopathy and diet and lifestyle. Not completely gone, but much better, except for pregnancy made them go away. So that was awesome. Not looking forward to them coming back though. So for me, my location for my migraines is usually on my left side of my head. And the sensation is it feels like my eyeballs are going to burst out of my head. Well, my left eyeball is going to burst out of my head. It is worse if I bend forward. So it's a modality. Worse if I lay on the side that's painful. Again, another modality. The intensity, it's like so bad that I feel like I'm going to die. So it's quite intense. There's no alternating concomitant that I have with it. So that's, you're not always going to have all of these things. So that's another thing to keep in mind. When I was teaching students, I would say, you want to look for at least 3. of those things to make sure that you have a full symptom. And so what else would I say about my migraines? They would always come on from, so etiology is another thing that we need to look at. That's like, modality, what makes it better and worse. So come on from exercise and being in the sun, specifically heat, but being in the sun. And so that's another modality that is worse from exposure to the sun, really, really intensely sensitive to light, sounds, odors, all of those things. So those are the kind of things that we're really looking for. Any motion makes my headache worse. But anyway, so those are the kind of things that we're looking for in miracles, which is similar to that Colomo.
Yeah, I like that it really kind of it goes deeper into what that actually means and what we're actually looking for. So I'm really glad you shared that, because I think it explains it a lot more obviously than just Colomo. And I like that you said that you typically said three of those when you're trying to take a case, because it's a triangulation, and that's really what we're doing, and that's why we're looking at the whole person and all of these different things, because together each of those things, like one of those things is not unique or special, but three of those things is unique and points us in the right direction. And so being able to use all the different symptoms that we're dealing with to triangulate and find the remedy.
So that's why we'll sometimes ask you if you've got children who are too young to be involved or not well enough to be involved, or it's too triggering for them to be involved, that we may reach out and say, okay, well, we need you to ask these questions and get back to us. And that's why, it can get really frustrating for parents when we're saying, well, tell me about their constipation. Well, they're just constipated. They've needed magnesium or Miralax their whole life. Okay, well, what does the poop look like? What does it feel like coming? Do they have the sensation to go and they can't? Do they super gross, but do they push a little bit out and it goes back in? All of these things are really, really vital for us to understanding. And for what it's worth, guys, physical symptoms are vitally important in recommending remedies for kids with PANS, because sometimes you're going to come to us and you're going to say, my kid has anxiety, separation anxiety, rage, and OCD, and their handwriting got bad, and they wet the bed now, and they never did before. And we'd be like, all right, that's every kid with PANS, or like not every kid, because that one kid with PANS is one kid with PANS, but that's like 50 to 60% of the kids with PANS have all of those things. We need to get into the specifics about how your kiddo experiences it, and that's where this Colomo or the miracles will help you get into those specifics.
Yeah, and like those symptoms can be broken down so much, like you were saying, and even bedwetting is more than just bedwetting. It's what time of night is it happening? How copious is it? Is it more urine than usual? Is it happening right before waking, or right after going to sleep? Really, the details of that timing is so important, and I think it's not something that parents think to observe or to write down. And so I want to definitely emphasize, like, timing and order of events and the way they happen is really important. Before sleep, during sleep, after sleep, before urination, after urination, during urination, before a bowel movement, after a bowel movement, during a bowel movement, before eating, after eating. All of those things play into the remedies that we choose. So adding those to your observations will be really helpful for us. My step number 4 was multiple data points, which is kind of that triangulation thing. So when you do see a symptom that you think could be useful, like, write it down, but you don't need to send it to us right away, because we're going to need more than just that one symptom. We're going to need multiple symptoms and data points of that symptom to know that it's relevant, and know that it's part of their chronic case, and know that we actually do need to prescribe on it. So write it down, underline it, say that you want to bring it up at our next visit, and then keep getting more information about it. If you notice, it is his constipation is always worse at night. Okay, good. Now get more information on the constipation. Continue to investigate. Continue to be that observer, and observe what's happening, and not investigate what's causing the constipation, like trying different foods and all of that, but just observe and continue to observe that symptom that you think could be useful, and then report back with as many data points as possible, which will give us the best view. And then my last step of being a better homeopathic observer is to keep calm and trust your homeopath. A lot of times there's a lot going on, and healing is not a linear process, and it, as miraculous and exciting as healing can be, it also goes the other way when we're dealing with the one step back. And so just keeping calm and knowing that you are moving in the right direction, even when things get a little bit worse, because the little bit worse is the next clue to the next thing that we need to do. So just remain calm, observe the symptoms that are a little bit worse, write them down, and try to get as much information about the observation as possible, and then bring it back to us, and we'll do what we're supposed to do with it.
Right. So Nadia, I just saw that you made a lot of faces about keeping calm. And I can hear the frustration from you, Nadia, and from basically a lot of other people who are just, how do you possibly stay calm with all of this? Okay. I'm in the process right now of deciding which of the things were recommended for our monthly self-care challenge, whether we do mindfulness or if we do like a self-appreciation challenge. And I decided we were gonna do self-appreciation, but now I'm almost like, okay, so because of this talk, maybe we should do mindfulness again. I've done a guided mindfulness challenge last year. I can just go and find it and like copy and paste the whole things, so we can teach you guys a little bit more mindfulness. But mindfulness and like having some sort of mindfulness or meditation practice is so useful in this process. It's useful for you to stay calm, and it's useful for you to become a better observer of things, because then it allows you to bear witness to something without engaging in it. And that's really where the difference is between being an investigator versus an observer, right? An investigator is looking for something to make this problem go away. An observer is just watching what happens. And yes, you're doing it from the perspective of you want it to go away, but you're handing that to somebody else to deal with, right? Somebody who that's their job to do. Like, your job isn't to make everything go away. Your job is to be mom and to call in somebody else who's better at it or who has the tools or the training to do it. I am not going to go and try to fix my car if something is wrong, because I don't know how to do it. I'm going to observe what's happening. I'm going to take it to the mechanic, and I'm going to tell the mechanic, here's what's happening, and then they're going to fix it for me. And I know that like your experience in the conventional medical realm has probably made that really hard to do. So I will acknowledge that fully, that like you probably tried to do that already and been thwarted left and right. We're not those docs. So, we've talked about this before. You don't have to convince us. We know that this is real. We know this is happening. We understand what your family is going through. We know how frustrating it is, and we just need to know what's happening. And that's the best way to get things moving forward. So we'll probably do a mindfulness challenge so we can help you guys learn a little bit of those skills to help you be more aware and able to observe. And that goes for like those feelings of like anxiety, panic, stress, to recognize like, okay, what I'm feeling right now is fear, or I'm feeling panic, or I'm feeling anger, or I'm feeling defeated, or I'm feeling frustration. And to be able to recognize that that's what you're feeling, and then allow it to just be, and recognizing then that it will actually move through on its own too. So that's a really helpful tool to be both able to stay more calm and to be a good observer. Dr. Petersons, do you have any?
Yeah, well, I think for all of these parents and kiddos, like, they've been through a lot, and having been through different treatments, and anytime that you have symptoms return, that kind of being like a signal that the treatment didn't work. And for homeopathy, that happening isn't a signal that the treatment didn't work. It's part of the healing process. It's to be expected. It's not something we're worried about when we see it. And so I get why when you guys see it, you are, because most of that has ended with, well, this isn't going to be the thing that helps. But with homeopathy, it's the next clue. It's the unpeeling of the layers of the dirt. It's part of the process, and we have to we have to go through those processes to get to the other end. And you know, a lot of you guys have experienced some of that and come out the other end. I know one of the moms mentioned, like, I sent an email and I said, I don't think this is a breakdown. I actually think this is a breakthrough. And just mom couldn't believe it. And she waited and she came out the other end and she was like, oh my gosh, Dr. Petersons, it was a breakthrough. It wasn't a breakdown. And I was like, yes, like, so happy, because like, that's, you know, we do get through it. And it's never a sign that it's never a bad sign. It's just part of the process.
Yeah. That's a tough thing for people to wrap their heads around too. And so that's why we're happy to keep doing these videos and chatting with you about it, and having, you know, lots of moms who've been there before you, who can talk to you about the process and how hard it was to get there. We know, we get it. But it's really a necessary but frustrating part of the process, because we're not using homeopathic medicines in a palliative or suppressive way. We're actually, it's just a nudge to the body to heal. And just like, you know, if like there's a noise that's, you know, going on right now, like my dog snoring over here, I could tell it really early on when we were started the video, because I was worried that you guys were going to hear her snoring and she's going to get really loud, and I don't even hear it anymore. And it's the same thing, because I just tuned it out, and your body will tune out homeopathic medicines, and we just got to adjust. If she started like changed up her snoring, I would hear it again. You know, same thing. That's why sirens. That's why car sirens are so loud and obnoxious, and they have so many different noises. If we had one sound, nobody'd pay attention to it, and we'd like to completely tune it out. So it's the change that keeps things moving, that keeps our attention, that keeps things going in the right direction. All right. Anything else that you wanted to make sure you covered?
No, I mean, that was the meat of it. Did anybody ask any questions?
None of the questions that were asked so far are relevant to this topic. So I'm gonna, I'll type out an answer, or like we can address it in another video, because we want to make sure we keep it relevant to topic. If anybody does have any like last minute final questions about becoming a better observer, Dr. Peterson, what would be great is if you just, rather than like, so we like talked about each of the steps, and I think it's fantastic that you broke them down into steps, and then we described them. While we're waiting to see if anybody has any last final questions, why don't you just give like those bullet point steps again?
Yeah. So step 1, moving from being the investigator to the observer. Step 2, just watch and record, quantity and quality. Step 3 is, you know, look for what's important, which is our conditions, locations, and modalities. Special attention to things that make it a little bit better or a little bit worse, and going into the nitty-gritty details of those symptoms. And then, you know, step 4, gathering multiple data points before you report. And then step 5, keep calm and trust your homeopath.
Fantastic. All right. Well, I think this was hopefully as helpful as I mean, let's be perfectly honest, guys. Dr. Petersons and I are coming at this from a different perspective than you are. So we're trying to do our best to bring our doctor knowledge to our clients' level of understanding, so that it's useful for you guys, and that it can help us do our jobs better. But we also recognize sometimes we get like doctor talk. So if we got like too doctory with anything, let us know. We'll be happy to jump on and clarify, or like type up a question, an answer to clarify for you. If you have questions, if you're watching this on the replay, definitely ask us. Tag me or Dr. Petersons in the questions, whichever one of us that they're for. Any final thoughts, Dr. Petersons?
No, I think that was great. And if there's any other questions about, you know, if you want to get more into what is condition, location, modality, or you have any more specific questions about what we were talking about, I know it can get a little confusing. So please don't hesitate to ask. We're here for you.
Yeah. And don't feel bad if it's frustrating, guys. Like, you know, so Dr. Petersons and I are doctors, but we're also patients. You know, we use homeopathy for ourselves, and I have to put myself in that place. Like, I can't tell you how many times I will tell my doctor, you know, that, you know, who's going to take my case, oh, I don't really have any good symptoms, so like I don't know if it's even useful. And then like, sure enough, talking to my doc, I can get good symptoms too. So it's not all on you guys that you have to find these things. It's a relationship. So your doctor is trained in how to get these symptoms from you, but you have to have paid attention enough to be able to figure them out too. So that's where it comes together. So it's not all on you. We're not saying, hey, you got to give these to us, or that's it. Like, it's our job to help tease them out and help remind you, well, what about this? Well, what about that? That kind of thing.
Absolutely.
But it can be hard, even for people like, who've been doing this for years. It can be hard to recognize these symptoms. So don't put a ton of pressure on yourself that, like, if you can't get it, that there's no hope or anything like that. It's not true. We'll work together. We'll help you find this. We get it. We'll ask you questions. You can go back, get the answers, and come back to us too. If it's a deal breaker, if we don't have the answer, we'll let you know, and we'll pause and wait until we can get it. No rush. Okay. Somebody did ask a question. How would you be able to tell what time the bedwetting happens?
That's a great question. So sometimes you can't. Sometimes they go to sleep and you can't really necessarily tell. Some kids wake in the middle of the night and they're not wet yet, and then they go to bed and then they're wet when they wake up. Some people will notice that with the bedwetting, it will only happen on certain nights, and sometimes it doesn't happen on the nights that kids will stay up later or wake up earlier. So even just noting, like, oh, for some reason this one night they didn't bedwet, and then we'll help you kind of figure out, like, well, was it because they stayed up later and they typically bedwet late at night or right when they go to sleep, or did they wake up early and they typically bedwet right before they wake up? So we'll use things like that. And then sometimes with pull-ups, you can tell if they've urinated outside of their pull-up, then that's like more urine than typical, or if they've only urinated a pull-up, or if they have to change their pull-ups multiple times per night. All of those things become relevant. And if they wake you and they have a wet pull-up, and then you wake them in the morning and they have so that's that tells us something about timing, as well as quantity and more specifics about that. I hope that answers the question.
Yeah, and then that is one of the tougher ones to figure out, especially if you're not going to go in and check on your kids every hour or so. And we definitely don't want you to have to do that. But that's sort of what Dr. Petersons was saying, is that, like, you just giving multiple data points, like, here's what happened this night, here's what happened this night, here's what happened this night. That's our job, to sort of like take a whole bunch of information and boil it down to, like, the essence of what it is. And that's why so many people will say that, like, their homeopaths end up feeling like therapists, because they're so good at taking all this. Well, it sounds like all of these things are this, really, right? And we're not trying to help people work through something. We're just really good at summarizing, like really good at getting things down to, like, the core. And that's really what our job is. Jody always tells me that, like, I'm really good at, like, bringing things together when we're having, like, these talks, and, like, boiling it down to, like, a simple thing. It's not something I'm just good at, like, that's because of homeopathy. That's like why all of us are good at, like, okay, all of these things together comes to this. This is what it is. So just do your job of observing, communicate openly with your doc. Try not to get frustrated with us when we ask you lots of these questions. It's because we're trying to get to these details, and we're trying to be the investigator to figure out what exactly it is that's going on, so that we can then find the right thing to help move things forward. So, all right, if you guys have any other questions after the fact, if you're watching this on replay, definitely hit us up, tag me, tag Dr. Petersons, and we'll make sure we get back to you. Until we talk to you guys again, everybody, take care.